Hello, everyone, and welcome to another edition of A Grain of Truth, the Gluten Summit. And I am absolutely delighted to be here today with Dr. David Perlmutter, board-certified neurologist and fellow of the American College of Nutrition, recognized for his cutting-edge approach to preventing and working with neurological conditions by addressing their root causes. Dr. Perlmutter is a frequent lecturer at symposia sponsored by such medical institutions as Harvard University, the University of Arizona, Scripps Institute, New York University, Columbia University, ... He has contributed extensively to the world medical literature with publications appearing in the Journal of Neurosurgery, the Southern Medical Journal, the Journal of Applied Nutrition, the Archives of Neurology. He is the author of many books, including the Better Brain book, Raise a Smarter Child by Kindergarten, Power Up Your Brain, The Neuroscience of Enlightenment, and most recently, Grain Brain. I personally recommend Raise a Smarter Child by Kindergarten to every new parent. In 2002, Dr. Perlmutter was the recipient of the Linus Pauling Functional Medicine Award for his pioneering research and clinical work on the role of diet and nutrition in brain-related disorders, and the American College for Advancement in Medicine's Denham-Harmon Award for his innovative work on free radical science and its application to clinical medicine. In 2006, Dr. Perlmutter was the recipient of the National Nutritional Foods Association's Clinician of the Year Award. And in 2010, he was awarded the Humanitarian of the Year Award from the American College of Nutrition. Dr. Perlmutter serves as a medical advisor to the Dr. Oz Show and has been interviewed on many national radio and television programs, including CNN, The Today Show, and Oprah. Dr. Perlmutter, thank you so much for joining us today.
Well, Dr. O'Brien, it's my pleasure. Thank you for having me.
My first question to you, Dr. Perlmutter, you are one of the world's premier neurologists teaching doctors the big picture of how to diagnose their patients, how to find the underlying triggers to the problems that the patients might be presenting with. How important is inflammation in that line of thought?
Let me take a step back if I could. Just a thought occurred to me while you were asking that question in terms of being a diagnostician. And it's a quote that comes from Louis Pasteur that says that chance favors the prepared mind. And the reason I was thinking about it while you were doing that introductory question is because when you prepare your mind, when you explore other ideas, then you enhance your chances of making that right discovery that can have a major impact on that individual patient that you might be treating that day. That said, even broadening a person's perspective, a healthcare practitioner's perspective, to understand the fundamental role of inflammation in areas that I am particularly interested in, like neurodegenerative conditions, really expands not only the understanding, but the therapeutic options, not only in treating neurodegenerative conditions, but actually preventing them. So the question was, how important is inflammation? Inflammation is the cornerstone of Alzheimer's, obviously multiple sclerosis, and also things like Parkinson's. These are fundamentally inflammatory diseases of the brain. And, you know, people don't really recognize that because we're all familiar with the cardinal issues of inflammation, of swelling and redness and pain. But when your brain is inflamed, you're not going to feel it. You're not going to know. But absolutely, all of the chemical markers of inflammation that you might have in an arthritic knee are the exact same players that are involved in the disease that we call Alzheimer's. So where do we go with that information? Well, right off the bat, we can get a leg up on preventing Alzheimer's disease. And again, what did I just say? Preventing Alzheimer's. No one wants to talk about that, but you know, the Lancet Neurology just published a report saying that more than 54% of the current Alzheimer's patient load in the world could have been prevented if specific lifestyle issues would have been addressed. And in this country, that represents about 2.6 million people right now who carry a diagnosis of Alzheimer's, a disease for which there is no treatment or cure, that didn't have to be in that situation in the first place. To get back to your question, how important is inflammation? It is absolutely fundamental. Now, people are beginning to get, and I'm giving you the short answer here, people are
Fine.
beginning to get this notion that there's some relationship between Alzheimer's and dysregulation of blood sugar. In fact, to the extent that some people go as far as calling Alzheimer's disease diabetes type 3 because of this profound relationship. And it turns out that this does wonderfully relate back to your question, because it is true that there's this direct relationship between blood sugar elevation and Alzheimer's. As a matter of fact, just last week in the New England Journal of Medicine, a powerful study was published demonstrating even mild elevations of blood sugar, just a little bit north of 100, already correlate with risk of dementia. We know that elevations in hemoglobin A1C are directly correlated with shrinkage of the hippocampus, or the brain's memory center. But how does this relate to inflammation? I'm going to bring it back around. When your blood sugar is even mildly elevated, it raises a process called glycation. And glycation is the process by which that mild elevation of blood sugar binds to proteins. When blood sugar is elevated and binds to proteins in this process called glycation, two bad things happen. Number one, it dramatically increases the production of chemicals that are called free radicals, which damage everything in sight. And number two, glycated proteins, or proteins that are bound to sugar, dramatically increase the process of, as you mentioned, inflammation. And this is devastating for the human brain. So, in a very real sense, we can control the set point of inflammation in our bodies, not by necessarily eating turmeric and taking anti-inflammatory medications. I mean, I'm all for using turmeric and other herbs and omega-3s, etc. But step one, the biggest issue, is to cut back on the carbs. It's the carbs that are the killers, fundamentally, because ultimately a high carbohydrate diet leads to this modification of proteins that dramatically increases inflammation and the production of damaging free radicals, which damage our DNA, our fat, our protein, and really every part of the body. So again, you know, it's interesting to talk about food allergies, food sensitivities. I know we're going to be talking about gluten in just a bit. And but the big issue, the thing that is of importance to 100% of humans on this planet, is the excessive carbohydrates in our diet. And, you know, that said, where I'm going with this is really, what is the ideal diet? And we'll get to the gluten-free part in just a moment. But the ideal diet in terms of macronutrients of protein, carbohydrates, and fat is an extremely low carbohydrate, high fat diet, eating more fat and dramatically reducing carbohydrate. And it's a revolutionary, brand new diet. It's only been just the past 2.6 million years that people have begun to eat this food.
That is a brilliant summary. And for our listening audience, one of the things that you heard from me already is that fat is not bad for you. Bad fat is bad for you. So, Dr. Perlmutter, what types of fats would be good fats to consider in the diet?
Always an excellent question. And I do digress, I guess. I didn't realize I did, but I do. Let me start with, again, the importance of fat, and we'll talk about good and bad fats. So fat is a fundamental player as an energy source in human physiology. But beyond that, it is a fundamental structural component of really every part of your body, but most importantly, the membranes of the cells, and some of those cells happen to be nerve cells. The membranes are made from fat. Healthy cells require healthful fats.
For our listening audience, the membranes are the walls of the cells.
Exactly. Well, the walls, I guess, not exactly a cell wall, but that's correct. So that said, the cells, your brain cells, your body cells, are constructed from the fats that you elect to consume. Now, when a person is consuming very highly modified, long shelf life types of fats that you find on the grocery store shelves that are there month after month and have been modified in such a way that they will not go rancid, those are dead fats. They're damaging fats, they'll destroy the brain, and it's really what we need to absolutely avoid. The good fats are the wonderful monounsaturated fats, fats like olive oil, coconut oil, avocado, wonderful fatty food, even grass-fed beef if you choose to eat beef, wild fish as opposed to farm-raised fish, nuts and seeds, wonderful fats to add to your diet every single day. And you know, the main pushback I think that people experience or conceptualize in terms of these recommendations of improving or increasing your fats is, first, recognize that pretty much everybody has about 35% of their calories from protein. So the variables here are either a low-fat diet, which became popular in the early 1990s, at which point diabetes rates exploded, or a high-fat diet. When a person goes low-fat, where do you fill in those calories? You fill them in with carbohydrate. If you're high-fat, then you're cutting back on your carbs, and I absolutely favor that. And it's not just, Tom, that you have me on as a guest today and we're talking about what are my preferences and you wonder why. I mean, here I am a guest on this program, and where did I dream this up? Well, you know, there's a whole paleo movement that attaches itself to a high-fat, low-carb diet for a number of reasons, but I think it's really relevant that we go back and look at what is the peer-reviewed science telling us about what is really best for human physiology. The main pushback for people eating high-fat is they somehow have this perverse idea that this is going to cause heart disease, and nothing could be further from the truth. People say they're going to go on a low-fat diet because that's going to help them lose weight, and again, nothing could be further from the truth. The science doesn't support that. When you look at what was published in the New England Journal of Medicine back in 2008, there was actually a study called Weight Loss with a Low-Carbohydrate Diet, Mediterranean Diet, or a Low-Fat Diet. Head-to-head competition. Let's look at the science and see what happens to people. They took 322 moderately obese adults, average age 52 years, and they put them on one of these three diets, low-fat, low-carb, or Mediterranean. And obviously the extremes were the low-fat versus low-carb. Low-fat is really the diet du jour. It's what everyone's telling you to do. Just last week, former President Bush had a placement of a cardiac stent, and when the program, after the segment was aired on national news, the media advisor for the national network said, once again, what we really need to emphasize to people is they've got to lower their carbohydrates and absolutely reduce their intake of dietary fat. That's not fair because it's not based on science. It's based on mythological information that comes to you courtesy of people who have interest in making sure we eat a high-carb diet. So if you're eating low-fat, you're eating high-carb. Let's go back to the New England Journal of Medicine study. What they found was in the 2 years when you compared the low-fat versus the low-carb diet, those who ate low-carbohydrate had a dramatic and a significant increase weight loss and kept the weight off much more aggressively than the people on a low-fat diet. The HDL, or so-called good cholesterol, went up dramatically in people eating lots of fat. The triglycerides are a powerful marker of risk for cardiac events. The triglycerides dropped 23.7 points in people eating a lot of fat and low carbs. 24 points. In people on the low-fat diet that doctors will tell you to go on for triglycerides, the triglycerides went down 2.8 points, 1/10 of what they went down in people eating a lot of good fat. Fasting insulin was far better in individuals eating lots of fat, as you would expect, because they're cutting back on their carbs. LDL, or bad cholesterol, reduced by 3 points in people eating a lot of fat and not even anything statistically significant in people on the low-fat diet. So really across the board, and perhaps from my perspective, most importantly, what improved so dramatically in people eating a high-fat diet was that their C-reactive protein went down dramatically compared to people on a low-fat diet. And that gets back to exactly what you asked me in the first place. What is the importance of inflammation? Now, C-reactive protein, for your listeners, is a blood test that many doctors perform because it's a marker, a blood marker of the activity of inflammation in our bodies. The higher the C-reactive protein, the higher is this process we call inflammation. And having said that, this study, published in probably, arguably, the most well-respected medical journal on the planet, showed in an interventional trial, in other words, where they gave people something, diets to stick to, showed that the best diet to reduce inflammation is a high-fat, low-carb diet. Inflammation is the cornerstone of coronary artery disease and Alzheimer's, and obviously any number of other problems. So again, it's great for us to talk about people's ideas, but I think it's really far more important that we go toe-to-toe with what people are being told and look at what is the mainstream science telling us. The best well-researched studies are telling us about what we should be eating.
That's an amazing summary of the current research, and it's so consistent with the conversation we had with Dr. Mark Houston with the science from the cardiovascular and vascular biology point of view. High-fat diets are recommended once again. That's quality fats. It is.
Isn't it amazing that?
It's amazing, to keep coming back to what makes sense and what the studies are telling us. And it doesn't matter if you hear it from a gastroenterologist or from a neurologist or from a cardiologist. For those specialists who are reading the studies and staying current on what is right out there being proven, a high-fat diet with quality fats and lowering your carbohydrates works time and time again.
Without question. And, basically, again, this is the diet that we have eaten for 99.99% of our time on this planet. And so we've always been exceedingly low in carbohydrates. Where would we have gotten carbohydrates as hunter-gatherers? Maybe in the late summer or early fall when some wild blueberries or raspberries were finally ripened and they were sweet, we would consume those carbohydrates, and that would stimulate the body to produce insulin, whose primary job it is to cause the body to make and store fat. And in the late summer and early fall, we need to start storing fat because winter's coming and we have to make it through the winter. Well, winter's never coming for us today. We don't need to be packing on fat because it's not going to be a time of food scarcity. But yet, people are challenging themselves with high levels of carbs and sugars day in and day out, stimulating their bodies to make insulin, making and storing fat for the winter that never comes. So, people say, oh, I have a sweet tooth. You know what? Everybody on the planet has a sweet tooth. It's why we're here. It's why we survived, because, in fact, we were able to make it through times of food scarcity because we did eat carbs from time to time. We were drawn to sweet foods, meaning ripened fruit, basically. It's the only carbs that were available. We were drawn to them because that's, oddly enough, when that fruit has the highest level of vitamins and other things that are good for us. And frankly, it was actually good for the fruit as well, because when fruit ripens, its seeds are ready to be spread. So what a beautiful symbiotic picture that does paint. Nowadays, we're using that same mechanism in our brains to seek out sugar and carbohydrates to our absolute destruction in terms of our health. I mean, you just look around. Go to an airport when you're traveling, and just all you see are people who are very, very ill appearing, and signs at the airport that say terminal. So it's kind of a moment to take a deep breath. So it's an interesting time.
It is, and it's such a wonderful explanation you just gave, which I've not heard before, quite honestly, is that the carbohydrates, the high concentrated carbohydrates that our ancestors had access to, were the fruits that were ripening in the fall. So our ancestors would eat more of these fruits because they were available, and they'd put on a little extra fat because here comes the winter. And it was a beautiful dance. And
yes,
today...
it was. And we're saddled with that genetic issue, and we have to adjust to make it work. But what got me to that place is that the genome that we have now was selected for the past 2 million years, or at least the past 50,000 years, because it's the genome that allows us to survive in that environment, which was high fat from game that we killed, low carbs. We never, ever had access to carbohydrate. We didn't have wheat, gluten, the hybridized fruit, and not to mention all the rest of the, highly processed foods that are so abundant today. I mean, wheat as a carbohydrate, before we even get to the gluten issue. Wheat products represent 20% of the calorie ingestion of humans on the planet today. And those calories are virtually pure carbohydrate. There is some minimal amounts of residual fat and protein, but basically, the breads and the pastas are carbs.
Dr. Perlmutter, in an article that you recently published in Integrative Medicine, for the first time, that in patients presenting to a neurologist's office, compared to 14% of those without a sensitivity to gluten who complained of chronic headaches, you found there were 30% of those people with chronic headaches that had indicators of celiac disease, and 56% of those people presenting with chronic headaches that had indicators of non-celiac gluten sensitivity. Did you recommend eliminating gluten for those people, and if so, what happened?
Let me take a step back, and I guess I do that a lot, just to clarify the question. And again, we are really all over this notion that gluten sensitivity, apart from celiac disease, can be playing a role in any manner of illness that seems to befall humans today. So historically, and unfortunately many physicians will still cling to this idea, if you don't have a gastrointestinal complaint, then gluten is fair game, don't worry about it. Well, as it relates to the brain and things like headaches, we're seeing an incredible explosion of data coming our way demonstrating that, in fact, many neurologic problems have at their core anything that can induce inflammation, and front and center, certainly in my mentality, is gluten, because gluten sensitivity is so vast. As you know, I wrote a new book that just came out called Grain Brain, and that's really the pivot point in Grain Brain, is that at least consider gluten sensitivity, and if you don't want to do any expensive blood testing, my goodness, at least try a gluten-free diet. We find gluten sensitivity in a large number of our patients with headaches, ADHD, depression, dementia, certain movement disorders, and in 10% by the literature of individuals with schizophrenia. So there are, in fact, pharmaceutical fixes for some of these things, or at least pharmaceutical ways of treating the smoke while the fire is ignored. But why not get to the cause of the problem? Why not treat the fire, which is, in these situations, the body's reaction to a protein to which it is not receptive? That, gluten is basically a protein that we are not designed to accept.
I fully agree. And in your practice, if you see a schizophrenic patient, as you said, 10% of them have the indicators of non-celiac gluten sensitivity. Have you recommended a gluten-free diet as part of the protocol, and did you see a response from that?
Absolutely. We basically do that every day. And, I think I would like to just pay respect to Dr. Marius Hadjivassiliou, and he is a British researcher who really, I think, blazed the trail way back in the early part of the century of 2000, in beginning to publish articles dealing with the neurologic consequences of gluten sensitivity, and really made it very, very clear that we have to be thinking about gluten sensitivity when we are either puzzled by a neurological condition or we're up against a well-known neurologic condition, but we have very little to offer to the patient. And, let me rather quote something that he says: neurological manifestations of gluten sensitivity are a scientific fact, not a theological issue. The debate continues. We owe it to our patients to screen them effectively for gluten sensitivity with widely available anti-gluten antibody tests so that we do not, in the meantime, deprive them of a harmless but potentially effective treatment in the form of a gluten-free diet. Again, it gets back to the quote from Louis Pasteur, chance favors the prepared mind. All of your listeners now are prepared for this chance occurrence of helping either themselves or somebody else by knowing how widespread the consequences of gluten sensitivity are, and more importantly for our purposes today, that gluten sensitivity can be a neurologic problem without any involvement of the gut whatsoever. We've really got to get away from this notion that, without gut involvement, there's no problem with gluten. That is so old school, and that mentality really plays to the disservice of so many people who have problems and they just can't get through them. They end up taking drugs to treat this or that, and they're only masking the issue.
Absolutely correct. Absolutely correct. Our listeners have heard in this program from the immunologists, Dr. Aristo Vojdani and Yehuda Schoenfeld, about the mechanisms of cross-reactivity. Can you tell us from a neurologist's point of view what this means and how it may present in a neurologist's office?
So cross-reactivity means that in individuals with gluten sensitivity, they may actually cross-react with other types of proteins. And there are many prolamines, other types of proteins that in fact people may react to, and there are actually publications out that, or rather testing that's out, that allows you to actually identify those individuals and actually treat them by restricting their sensitivity. Dr. Vojdani has done an incredible job at creating these studies and identifying them, and in fact, I recently published a paper with him in a journal called Case Reports in Immunology, and what we discussed in that report was, again, differentiating this notion of pure, straightforward celiac disease with being sensitive to gluten, non-celiac gluten sensitivity, and how that related to to gut issues specifically. And in fact, we published another paper, Dr. Vojdani and I, dealing with headaches and gluten sensitivity, and also the finding of a non-gluten related, as you described, protein that was a casein, which is a protein, for your listeners, that's found in milk. And we published that article in Integrative Medicine back in April of this year. So the problem is that once the gut becomes sensitized to gluten, it causes a bit of a feed-forward process. Gluten consumption in the work of researchers has been demonstrated to actually increase in the gut the production inside the cell of another protein. I don't mean to be too technical, called zonulin. But ultimately, according to the work of Dr. Alessio Fasano, when we eat gluten, it opens up the lining of the intestine. It makes the intestine more permeable. The problem with that is then the intestine allows a variety of other proteins to come across the gut wall and challenge the immune system. So this picture gets a lot bigger than just simply gluten. Gluten is kind of the the vanguard that opens the door and then lets all the other soldiers in to do damage. And those other soldiers are the other proteins that might not have been a problem for us had it not been for our sensitivity to gluten, which, according to Dr. Fasano, may very well affect 100% of humans on this planet. And that is a very, very powerful notion, because if this indeed is the case, then what's happening is that we're allowing the immune system to be challenged, which paves the way for all kinds of inflammatory diseases, autoimmunity, and, as Dr. Fasano has described, even cancer. He wrote a paper in Physiology Reviews back in 2011, and the title talked about this protein zonulin, which is stimulated by gluten, and I'll read you the title. It's regulation of intestinal barrier function. But here's the interesting part. The biological door to inflammation, autoimmunity, and cancer. And what is so profound is that this is a mechanism that happens in all humans, not just the 30% of us or more that may have blood tests that show that we are sensitive to gluten. This is all comers. It's all of us who mount an increased permeability of the gut when exposed to this perverse protein called gluten.
That is exactly what Dr. Fasano talked about in our interview with him, and reinforced once again how gluten can be the door opener that causes a cadre of problems, including the development of autoimmune diseases and cancer.
And this is actually good news. It's what we're talking about today is groundbreaking good news, because we certainly are profoundly compromised by inflammatory autoimmune diseases and cancer. So why is it happening? We're puzzling over why are we seeing these rates of all these horrible things happening, and now we may have an answer. Dr. Fasano talks about the biological door. Well, we may now be able to lock that door. We may be able to lock the door by restricting gluten consumption, number one, and then also doing our very best effort in terms of rebuilding the health of the gut lining. Aggressive good bacteria called probiotics, adding in nutritional supplements like glutamine to allow the gut to calm down, heal itself, and begin to rebuild those vital intestinal barriers to keep out the invaders. So I feel very empowered by these conversations and this information, because it really, gosh, it just gives you so many leverage points to really have a big impact. But the information, people say that, oh, Dr. Perlmutter, what you're doing is really outside the box. That's really your mission in life, to practice outside the box. Wrong. My mission is to make the box bigger, so that this information is accepted and utilized across the board by mainstream medicine to help the millions and millions of people who are sick and don't know why.
And that is our mission. I share that with you, Dr. Perlmutter. I have a copy in my hand of your integrative medicine article that you just referred to, the case study of the patient with headaches and non-celiac gluten sensitivity. And you ran the tests on him that looked for 24 different tissue antibodies. That means indicators of an autoimmune condition where the immune system's attacking itself. 24 different tissues. And you found that this person had, what was it, 12? 10? No, 12.
Yeah, I mean, he an interesting case, because here is a terrific guy, doing his best, suffered from headaches for almost all of his adult life. 30 years he'd suffered with migraine headaches, and had been to all of the top so-called headache clinics around the world, was on various medications, anything you can think of that you might use in a headache program for this 66-year-old fellow, beta blockers, anticonvulsants, you name it. And that said, again, we decided to go ahead and test him for sensitivity, not just to gluten, but for a variety of other things. And he absolutely lit up across the board in a variety of things in the gluten panel, and also in terms of some of the markers indicating milk-related allergy problems quite significantly. So we indeed put him on a gluten-free diet, and in addition added in good probiotics and some glutamine. And he had a dramatic improvement, being able to almost completely stop all of his medication, and he was on daily dosages of some very powerful drugs. And, we have to understand that, so this is one case, and let's just say that gluten sensitivity may be playing a role in, let's say, 1% of people. But when you realize that headaches, for example, just as one clinical entity, are pandemic, affecting 22% of females in America and 10% of males, even if just 1%, and I know the number is much higher, of these individuals is better with a gluten-free diet, that's tens of thousands of people who get to stop their medication and can begin to live a normal life. So
yes.
when you look at people who are known to be gluten sensitive, 56% of them have headaches. So it's a common finding in individuals who have headaches, and I think you don't even have to test them. Why not just say, okay, here's what we're going to do. Over the next 6 weeks, we're going to go gluten-free and see what happens. What's wrong with that? Everybody's saying that, well, this gluten-free fad is only because a particular tennis player has claimed that his game improved because he went gluten-free. And that doesn't gel with the current level of sophisticated, mainstream, peer-reviewed science that is all over this. And why we're not hearing about it is a bit of a mystery, but I think that, where people get their information is from the nightly news, the media, the internet, and basically it's, business as usual. Make sure that we treat everything with drugs and not worry about things like prevention.
And in this case study of this gentleman that you just referred to, there are 2 points that I want to bring up for our listeners. One was that there was a family history, that he had a sister who also had intractable headaches, so there may have been a sensitivity to some trigger, such as gluten or dairy, that was a genetic inheritance. And the second thing was that when you retested him and his gluten antibodies had come down, correlating with the reduction of his symptoms, 8 out of the 10 antibodies that were elevated to his own tissue, the autoimmune process that was going on in his body in 10 different tissues, 8 out of 10 of them reduced dramatically.
Into the normal range. That's right. So that's the reason we published the study, is because we wanted to show people that, yes, not only is this anecdotal that the man said my headaches are better, but his laboratory studies, which is objective evidence, dramatically improved. And I think that article may be available online, I'm not sure, but for your listeners, it was in the journal Integrative Medicine in April of 2013, this year, Integrative Medicine, April 2013. I don't know if it's available online, but I think I did post a link to it on my Facebook site, which is David Perlmutter, MD.
Excellent. And Dr. Perlmutter, what would it mean, for example, in this gentleman, his cerebellar antibodies that were elevated? First, what does it mean if he's got elevated levels of antibodies with cerebellum, but he doesn't have any symptoms of dysfunctional cerebellum? What does that mean? And what does it mean when the antibodies come back to normal?
It's a very good question, because we have known for a long time that some individuals develop problems with the function of their cerebellum. That's the back part of the brain, where they can't move their arms and legs in a coordinated way in what we call ataxia. So there is this syndrome called cerebellar ataxia, which for years has been known at times to be a consequence of gluten sensitivity. That's in the mainstream literature. So beyond that, so here's a fellow who's overtly sensitive to gluten, and in fact he has those antibodies against the cells of his cerebellum brought on by his gluten sensitivity. I don't know, had we not treated him, what would have happened to him. I mean, he would have been, in my opinion, a very strong candidate to start having troubles with the coordinated movements of his arms and legs. So in a very real sense, that is, that might be preventive medicine. Who knows? Because, we ended up treating him. But this gluten ataxia has been described for a couple of decades, and you can actually measure the antibodies against gliadin, a protein that's found in gluten, in the spinal fluid of these people who have this issue. These days, there's actually a much easier way you don't have to stick a needle in somebody's back. You can measure one of the markers, actually, that we measured on this gentleman, called, and I don't mean to be technical, but it's a tissue transglutaminase, or TTG. And that's a kind of common gluten sensitivity blood test that people can have. And that correlates quite specifically with the development of this coordination issue. And yes, gluten sensitivity can cause problems with coordination and a movement disorder, even tremors. I often present the case of this 22-year-old gentleman who came to see me with what's called dystonia, where he was moving all around, and the doctors told him what he needed to do for his movements of his arms and legs was inject them with Botox, as if that would fix the problem. That's not a joke. So we videotaped him and then put him gluten-free because we found his blood test was gluten sensitive. And after 9 months, took him a while, he was perfectly normal in his movements. And I show a before and after videotape oftentimes when I lecture to professional groups.
And if I've seen that video, and it's shocking. It's just shocking to see the difference.
You know, the mission for you and me today, I think, in this interview is to really let your listeners recognize that this issue with gluten sensitivity has widespread manifestations throughout human physiology. Our purposes today are to tell you that, look, any number of brain issues, neurologic issues, can possibly be related to gluten sensitivity. And again, keep an open mind, because the data is really starting to explode, and people are really starting to publish these case reports of dramatic improvements in things related to the brain in people who've gone gluten-free. You know, the Mayo Clinic several years ago demonstrated a significant relationship of celiac disease, which at that point they didn't discriminate between celiac and gluten sensitivity, and dementia. And, you know, here we live in a time where there's no treatment for this dementia. And yet, according to the Mayo Clinic, recognizing this gluten sensitivity, as they said in their article, something along the lines of that it opens this narrow therapeutic window for the treatable causes of dementia. Meaning, we sure as heck don't have a lot for treating dementia, but this issue with gluten sensitivity may be, you know, open up that window just a little bit and give us some kind of advantage, give us some kind of way of treating people who are demented. That said, in my book, Grain Brain, I report the case of an 80-year-old Italian woman brought by her 2 sons who was profoundly impaired cognitively and who responded dramatically to simply restricting her consumption of gluten. It was breathtaking.
I'd like to go back for a moment to the question about antibodies to the cerebellar tissue. If, and this is for our listening audience, if the antibodies are elevated, there's a normal range that we may all have. But if you have elevated levels of antibodies, 2 questions. One, would that mean that the immune system is attacking the cerebellum and perhaps destroying some of that tissue? And could that be one of the causes of the inflammation in the brain that you spoke of earlier?
The answer to both of your questions is absolutely. So, again, when the immune system is activated, the body creates these antibodies that they're like locks, and they go around looking for the specific key that they can open. And sometimes in individuals who are gluten sensitive, these antibodies will specifically attack proteins found exclusively in the back part of the brain called the cerebellum. And you can measure these proteins in the blood and correlate that with this actual finding of what we call ataxia, this movement disorder. And I don't know how many of your listeners will do this, but the reference, I think I'm going to get it right, is from the journal Neurology. It was actually published 2013, this year, volume 80, page 1740. And it shows us how there is this direct relationship between this antibody against what's called tissue transglutaminase. I don't mean to be technical, but an antibody developed in the body because of gluten sensitivity, that antibody attacking the back part of the brain and causing people to have trouble moving. Gluten sensitivity causing movement disorder. What a concept.
And as some of our listening audience knows, and for all of you, if you have that sensitivity to gluten, it's very easy to develop the antibodies to transglutaminase.
Oh, it's very, very common. And again, you know, this was published in the journal Neurology. That's probably the most well-respected neurology journal on the planet. This is put out by the American Academy of Neurology. they're the group that tells you that you're a board-certified neurologist. So it's as good as it gets, and this is a sensitive indicator for gluten ataxia, this blood test called tissue transglutaminase, or TG, specifically number 6. There are several. So that said, hey, this science is in our faces, and we need to do something about it. And basically, to get back to the big picture, we're seeing significant health issues in humans as a consequence of our challenging our physiology with a protein that it is not prepared to handle.
And for our clinicians listening, and for the general public also, the transglutaminase 6 antibody test was put into the panel of the multiple peptides of gluten that we've spoken about before, array number 3 from Cyrex Labs. And it was Dr. Bojdani and I who began talking about this 5 years ago. Wouldn't it be wonderful if the technology were to allow the inclusion of transglutaminase 6? And Dr. Bojdani stayed on top of it, and he was able to discover that it could be done, and now it's a common test that's available for all of us.
And I will tell you, that test has been hugely helpful for me. In fact, that is the exact test that we performed on the patient that I reported earlier that I wrote about with the headaches. We may have actually missed his gluten sensitivity if he had gone to a regular lab and had your standard anti-gliadin antibody. So we tested him for a variety of anti-gliadin antibodies, both alpha, gamma, many things that we looked at that would not be part of a normal celiac panel, because that's what it's still called, a celiac panel. And in reality, it has nothing to do with celiac disease. I mean, you can use it for celiac, but it's really a panel for a huge problem compared to celiac disease, which is gluten sensitivity. I mean, conservatively, gluten sensitivity affects about 30% of humans, whereas celiac is 1.8% of humans. So we've got to really understand the implementation of these powerfully effective tests like the Cyrex 3 study, and beyond that, recognize that we can actually test for those other proteins to which people may be sensitive with a test called Cyrex number 4. So, this is a simple test. It's one red top tube that any lab can draw, but you have to be specific. That's the test you want to get.
Yes. One more question on the transglutaminase 6, because I think it's such a critical component for people that have any cognitive symptoms they notice if they have an exposure to wheat. Many people complain of brain fog and things like that. Transglutaminase 6, please help me with this. My understanding is that it's a component of the blood-brain barrier, more or less the cheesecloth that protects the brain and doesn't let big molecules get in. And if you have elevated levels of antibodies to transglutaminase 6, can you then get tears in the cheesecloth so that you get, in effect, a leaky brain where larger molecules get in, triggering the inflammation process in the brain?
Absolutely. And, again, what you're measuring is not the tissue transglutaminase. We're actually measuring antibodies that are created against it, and, because that gives us some inferential activity about what's going on. But you're correct, and it's not just with respect to the brain. Obviously, these transglutaminase activity have widespread issues with reference throughout the body. So it's actually very, very important. Dr. Fasano has studied this, as you mentioned, quite extensively, and I think that we're just starting to get a handle on how pervasive this may be. I mean, there's indication now that TTG, tissue transglutamination, may be a marker for schizophrenia. So, we're just beginning to understand how aggressive this is going to turn out to be.
Dr. Perlmutter, a paper came out 2 months ago from Peter Green and Armin Aladini at Columbia University entitled Markers of Celiac Disease and Gluten Sensitivity in Children with Autism. They demonstrated that 24% of autism children tested had elevated levels of IgG antibodies to gliadin, and only 2 children had any blood markers of celiac disease. Do you find in your practice, seeing such a diverse set of the spectrum of neurological conditions, that there is an increased percentage of people who, when tested accurately, have indicators of gluten sensitivity without celiac disease?
Yes, and I think that, that work, that publication was really very important because it helps us differentiate, again, tease apart this notion of celiac disease with to other issues with reference to gluten sensitivity. I mean, the kids that they found with autism had a specific IgG antibody to gliadin as compared to healthy kids, but this wasn't necessarily an issue with respect to their gastrointestinal symptoms. But that said, interestingly enough, we do see a lot of gastrointestinal issues in kids with autism. We've known that for a long time. Not everybody has fully understood what that means. But interestingly enough, it was a specific test. For example, they didn't find other immunoglobulins to be probably relevant. So when they looked at those markers, as you well said, that relate specifically to celiac disease, like tissue transglutaminase number 2, there was no real difference. What was different was their responsiveness was their evaluation of other more gluten-sensitive types of blood tests. So it was really very, very interesting. And again, it tends to reinforce this notion that there's a gulf that separates celiac disease from all the manifestations of gluten sensitivity.
Given that this summit is concentrating on the systemic impact of a sensitivity to gluten, with or without celiac disease, how important is it for the thousands of clinicians who are listening to this to consider gluten sensitivity? I mean, really. David, you and I both are on the teaching faculty of the Institute for Functional Medicine, and our goal is to give doctors the big picture overview when they're trying to put together what's causing the patient's symptoms. Where do you put this sensitivity on the spectrum or the checklist of what a practitioner needs to consider?
Well, again, not to belabor this one quote, but we all want to help our patients, and we're all puzzled every day when we see certain patients with things and they can't get better and they're taking medicines and nothing helps. And again, the quote was from Pasteur that chance favors a prepared mind. My hope is that we can allow, through this information that we're trying to disseminate, the idea that gluten sensitivity is pervasive among human beings and that it can have pervasive and widespread clinical manifestations. So it's vast. I mean, this has the opportunity to open up incredible understanding of so many disease processes that have been sort of written off. Why do people get cancer? Why do people get lupus, an autoimmune problem, and have to be put on immunosuppressant drugs? What is the cornerstone of autoimmune problems? What about rheumatoid arthritis? You know, I not that it's a huge metric of interest, but I published on my Facebook site a link to an article from a rheumatology journal showing that some patients with rheumatoid arthritis improve when they go on a gluten-free diet. And people were sharing this. It went absolutely viral. So, I think this is a powerful, non-drug promoted approach to health and physiology that has incredible manifestations. Unfortunately, how medicine is practiced today for the most part is you come in and tell me your symptom, and I'm going to bust out my prescription pad and give you something to treat the smoke, not the fire. And what I am suggesting is a far more effective way to treat is to put out the fire, address the underlying problem, the fire, not just fan the smoke. And the underlying fire here in so many of our problems is inflammatory, as well as autoimmune, as well as problems with gene regulation that can manifest as malignancy. This is hugely cost effective because we're not using the drugs, we're making dietary changes. And because it's not drug-centered, we're not going to hear about it so much. You know, Dr. Jerry Avorn from Harvard many years ago actually published this in Consumer Reports, as I recall. And he did a study trying to determine where is it that physicians get their information when they read a medical journal. He found that more than 70% of that information comes from the advertisements. Now, I'm not being critical of that, or maybe I am, but the point is that that's powerful. That's the quick way out. It's the drug rep coming to your office saying, hey, doc, you want to treat headaches? Here's a brand new drug. Why don't you write a script? And if I were a typical practitioner and I had a woman or a man come in with a headache, I'd say, hey, here's a new drug, works great. Try it out and let me know. But that treats the symptoms, it ignores the fire. And now what we've learned is that this gluten sensitivity issue is the fire that is underlying so many of our common medical problems. And at this point, turning your back on this is like wearing a horse wearing blinders in a race. You're just not going to see what's going on around you, and you're going to miss out. So again, the importance of gluten sensitivity and getting the message out is, you know, that's the cornerstone of my new book, Grain Brain, which, as I mentioned, has wonderfully become a bestseller. I'm hoping because it's a great book, but rather than pat myself on the back, I think the other reason is because people are desperate for this information. They're desperate for this knowledge, and the proof is in the gluten-free pudding. When they go gluten-free, people are getting results, again, far more than a tennis player that said his game is better. So, you know, William Davis's book, Wheat Belly, what a fantastic service that book has provided to the world at large. You know, he broke the ice and really let us know that it's real. He's a regular guy. He's a cardiologist. I know him personally. We've lectured quite extensively. He's just doing his best to get this message out, and so you know, I'm thrilled that I had this opportunity to write Grain Brain and continue to expand this understanding about gluten, in this case, and carbohydrates as these two factors relate to the brain.
Well, Dr. David Perlmutter, thank you so much for giving us of your time and your knowledge. You have carried this message so eloquently in the world of neurology to us, and I know that our thousands and thousands of listeners are very grateful for what they've heard today. Thank you.
Well, I would tell you, I honor what you're doing with this symposium to get this information out, and it is desperately, desperately important. And you know, the word doctor doesn't mean healer, it means teacher. And so what you've been able to accomplish by getting this information out is, you know, personifies a doctor in my book. So I praise you for it.
Thank you, David. Thank you very much.
Hello, everyone. It's Dr. O'Brien. And I want to take a moment to acknowledge those companies who have supported us in putting together A Grain of Truth, the Gluten Summit. First, let me say I have no financial interest of any type whatsoever in any of these companies. They're just really good companies. And that's why I invited them to sponsor us. Whether they are laboratories or nutrition companies or information services, they are at the top of the field in what they do. Please take a look at each of these companies and their websites. And if you're so inclined, send them a message, info at whatever the company is or whatever link they give you. Just send them a message to thank them for the Gluten Summit and their participation in it. It would be most unusual for a company to receive 1,000, 2,000, 5,000 thank yous for sponsoring a Gluten Summit. So please take a moment if you're so inclined to do that. Cyrex Labs, array number 3, is changing and expanding the world of gluten testing because it is the most comprehensive and advanced gluten reactivity test on the market, period. The array number 3 tests for 9 different proteins and peptides of gluten, thereby drastically reducing the likelihood of false negative results. You can learn so much more at www.advancedglutentest.com. Whenever I need confirmation of a gluten sensitivity, this is my go-to test.